Hello, this is our little video on the drugs available for pain relief in childbirth. So what they are, what they could do and what side effects there might be. You can use paracetamol in labour. So it's the same paracetamol you would use if you've got a headache or period pains or anything like that. So the side effects are just as they would normally be, so quite low side effects. However, they might not be as effective in later labour. So when your contractions are quite strong, you might not feel much of an effect from the paracetamol. But early on, it can be really helpful just to take that edge off. The Gassinair, or it's also known as Entonox, is taken via a mouthpiece. So like the picture shows, or you can have it as a mask over your face, like you'd imagine an oxygen mask just over the face. So you can breathe this in quite well. It then helps you regulate your breathing in as well. The Gassinair is quite a quick reaction to the body. You can feel the effects almost instantly. So some people describe it as feeling quite drunk or a bit woozy, a bit kind of quite happy sometimes. People laugh. There's a short lifespan of Gassinair as well, so it's quickly in the body and it's quite quickly out as well. So some would find that the drowsiness is quite uncomfortable, don't quite like it, can be a bit sick, a bit nauseous. And there is some evidence to show that it can affect your B vitamin levels. So if you've got a low B vitamin level already, it might be worth a conversation with your midwife or the doctors just to see if it's suitable for yourself. Remy Fentanyl is a new drug that's used in labour. So it's given through the hand through a cannula, and it's fast acting and it's patient controlled, which means that you can administer the drug as and when you need. And it's also short-lived, so it doesn't stay in your system for long. Many that use this will report feeling quite sick or dizzy, and some itchy as well. I mean, you might not get these side effects. And it can also cross to baby, so things like their heart rate can change, which then makes a risk of further interventions needed. You will be monitored throughout this if you take this drug. Lupitine is another opioid drug. It's given as an injection usually, and it's usually into the thigh. So this drug can remove the pain sensations of labour, and a lot of mums that take this drug will report feeling sleepy or quite nauseous. There is more increased chance of interventions using pethidine, and it can have an effect on baby. So baby can be quite sleepy, not really wanting to feed much when they're born if you've had pethidine in labour. An epidural is thought to be one of the only drugs that can really take away the pain completely of labour. It's given into the spine through what's known as a catheter or a tube, and it can be topped up as and when's needed. You will most than likely lose the feelings in your legs for the time it's in there and for a while afterwards as well. So you won't really be able to walk around after birth for a good few hours. And you're more likely to be catheterised, so a tube into the bladder, because you won't be able to walk or have any sensations from sort of the waist down. So with this, there's higher chances of more interventions needed because you won't be able to walk around and the active birth won't be a possibility. There are some areas that have been using sort of a lesser level epidural, so you might be able to move much quicker afterwards and be quite mobile. So here's a bit of a recap of the drugs you can take in labour. There's paracetamol, there's Gassinair or Entonox, there's Remy Fentanyl, there's pethidine, and there's epidural. There might be other drugs in your local trust that are being used or trialled, so it's worth speaking to your healthcare professional to see what other options might be available to you. Some are available at home births and others you can only have in hospital. So things such as the Remy Fentanyl and the epidural will only be available in hospital. Pethidine is usually only available in hospital, but some trusts have tried that in home births too. Gassinair and paracetamol you can take in a home birth. So you can have a quick look at this little table, or you can pause the video just to have a look for yourself. Thank you for watching. So check out our YouTube for any more videos you might like around labour and birth and early parenting. If you want some more support, you can contact us for some of our doula support. We have free doula support across the UK,